Mga igala, kumusta? Welcome to another episode of the Sharon Makali Cariaga Show. And we are live at Aerial or Antenna Channel 37, Parasat at Jade Cable TV. That is Channel 27, 28, and 29. And we're also live at DEARBC Cable TV Analog Channel 19, DEARBC Cable TV Digital Channel 2. And of course, we are live at our FB page, JAO TV 51_official. And you could also see us at YouTube channel, JAO TV 51_official. The main role of primary health care is to provide continuous and comprehensive care to the patients. Along with that, primary health care provides increased accessibility to advanced health care system for the community, which results in excellent health outcomes and preventions of delay. Ladies and gentlemen, please welcome on the studio today the Acting Regional Vice President of PhilHealth for Region 10. Ladies and gentlemen, please welcome Mr. Dilio Aceron. Sir, good morning to you, sir. And yes, welcome to the city of Golden Friendship.
Yes, a pleasant good morning to all of you, to all the listeners and viewers, and of course to you, ma'am, a pleasant good morning, po.
Yes. So the world is actually suffering from a worldwide crisis now, and this pandemic has caused a lot of chaos, panic, and a lot of worries when it comes to our healthcare system. Now, recently, this COVID has struck the nation with its course, and it's not even a joke, you know, to just think about, you know, the destruction that it cost the family, the government, and it's especially on the healthcare system. Now, with PhilHealth now as an ally of the government, you know, giving us, you know, hope to actually solve some of our medical and health problems. Now, with this COVID, what can PhilHealth, you know, give us the benefit for the COVID package?
Yes. Well, you know, PhilHealth, by virtue of Republic Act 11223 or the Universal Health Care Law, we are now implementing the National Health Insurance Program. All Filipinos are now covered under the said law. And what good thing about that is that now that it's pandemic, PhilHealth has various packages, COVID-19 benefit packages. We do cover RT-PCR swab test. That's 3,409 in all accredited diagnostic laboratories and hospitals. We also have a package for community isolation units. We pay 22,449 to accredited CIUs or of the LGUs.
Right.
And we also have COVID-19 packages for those confined due to pneumonia.
Right.
For moderate pneumonia, for mild pneumonia, we have around 43,000 pesos case rate package. For moderate pneumonia, we have 133,000.
Right.
And if the final diagnosis of the attending doctor is severe pneumonia, that's around 333,000. And for critical pneumonia, 786,000 pesos is the case rate package. So when we say case rate package, it covers the room and board, medicines, diagnostic laboratories, and portion of the professional fee. So that is the support value of PhilHealth for all Filipinos who or their qualified dependents in case they will be confined due to COVID-19.
Okay, so how do they file these packages, sir?
Well, it should be automatic deduction. Because of the Universal Healthcare Law, all Filipinos are now entitled to the benefits. They need to be registered in our database.
System. Okay.
Yes, and of course the law provides, since the law took effect, the Universal Healthcare Law took effect November 2019, we have to ensure that our contributions are paid accordingly, but it will not hinder our fellow kababayans in Northern Mindanao in case you get hospitalized of all these benefits. You just need to be registered with PhilHealth.
Sir, in case if this person does not got enrolled with PhilHealth system and with the universal law, healthcare law, they should be included. So how are they going to avail of this? Just in case if this person does not even know about PhilHealth, and then how are we able to help them through this?
Well,
and then nagka-COVID.
Yeah, that's why we are intensifying that all members could register to PhilHealth. They can visit our nearest local health insurance offices, and then we are utilizing other platforms for them to be registered. They have to fill out the
this is an augmentation of the LGUs too, right? Like the local government units can actually facilitate through the CHIO, which is the City Health where they can actually enroll on these benefits?
Yes, the local government units are PhilHealth's partner. We need their support. We have the group enrollment program wherein the local chief executive may sponsor or may choose who among their constituents can be given coverage for 1 year. And then we need the support of the city health office or the municipal health office or the provincial health officers in facilitating, because the COVID benefits are here. We are trying to empower our members. That's why, as the new head of PhilHealth Region 10, I'm doing my best to really inform our kababayans here in Northern Mindanao that as a Filipino, you are entitled and you are covered with the various COVID-19 benefit packages which PhilHealth prepared for all of us.
So the time when we think about this, it's really it's a power to really know the details, no, the benefits that you can get from the government. Unless you don't know and you're not, or you're misinformed or you're uninformed, it's very unfortunate that people does not know that they can actually get this benefit from the government. Now, considering this, there are a lot of changes that we have felt through the PhilHealth system now, and there were a lot of controversies and there were a lot of issues that happened with PhilHealth. But then we tried to actually restructure that, and we have tried to reform PhilHealth. And it was a good thing that there was a mandate that, or the directive of the president, that the whole PhilHealth system should be reformed. So with these changes now, how are the people accepting this, and how are the people benefiting from this, that the changes has been made?
Well, the Universal Healthcare Law just took effect 2019, November, and it's still a work in progress. Not after its passage, everything's not perfect. That's why PhilHealth is just spearheading the Universal Healthcare Law. With the Universal Healthcare Law, just like to emphasize, we also have partners here like the Department of Health, the SWD, DBM, PAGCOR, PCSO, and of course the various stakeholders like the local government units, accredited and private government hospitals. And we need to come together in order to provide this benefit, especially PhilHealth's role is crucial nowadays because of this pandemic. My mantra here in Region 10 is that dapat ang PhilHealth po ay nararamdaman ng ating mga kababayan sa oras sila po ay magkasakit at ma-ospital. What PhilHealth really provides is financial risk protection. It is to give peace of mind that every Juan de la Cruz, in case na magkasakit, ma-ospital, at least meron po silang makukuhang kabawasan sa kanilang total hospital bill po.
Right. In Region 10, how are the collections made, and how are we on that update? That are the collections being made promptly, and that are we also paying our beneficiaries on time? And aside from that, from the hospitals that have been asking for the returns, are we able to help them out with that on time? Because before it was just so delayed. Every time they actually make their billings through the PhilHealth, matagal daw ang response when it comes to payment. So that's why there were a lot of backlogs that happened. And then we were trying to restructure that again on Region 10, because that was the biggest problem we were encountering, not only in Region 10, but all over the Philippines. And now, how is it now on those updates, sir?
Yeah. Well, admittedly, there are backlogs. Of course, our partner hospitals are claiming that we have not yet paid them, but that's why we're intensifying our various dialogues, because we need to reconcile with our records. Kasi ang nangyayari po, pati po yung mga denied claims and return to hospitals, sinasama po yan as collectibles.
I see.
So that's why we try to explain to the medical directors and to the other officers of the hospital that we can pay them if they don't have the complete documents, because of course the commission audit is really
very
checking.
keen on that.
Yes. And people don't know, and we would like to emphasize that we have a fiduciary responsibility, which is to ensure that every claim is with complete documents, and we have to ensure that every claim is properly, the right amount is given to the hospital. So this backlog occurred because of various reasons. And that's why some are the policy issues, some are technical issues. And of course, like the hospitals, we are also affected. Some of our staff are hit by COVID. Some lost their lives.
Yes.
And we have to abide with the IATF regulations that we can't have full force in the offices. But rest assured, PhilHealth is doing its best to fast track so that all the pending claims can be resolved, especially the return to hospital, because it is within the hospital for them to comply with the needed documents and signatures in order for us to pay them immediately.
Right. So are we on the, give us the percentage of that update now. Are we at 70% for that completion for all those backlogs that have been made?
Well, for the record, when an official statement issued last August 5, wherein it pertains to claims payment, for the record, we have around 12% not yet paid. We were able to pay from January 2020 to June 30, 2021, around 166 billion already.
166
yeah,
billion.
we have already paid our all accredited government and private hospitals. But yes, there are around 20 billion not yet paid because of return to hospital, 8%, and 3% were denied because of non-compliance to the provision of the law. And we'd like to inform the public that PhilHealth, by virtue of the law, we are given 60 days to process the claims. And the claims can be categorized into two. Good claims, so ibig sabihin, kompleto na supporting documents and signature. And there are crude claims or bad claims wherein incomplete documents or it does not follow the law or the provisions of the Republic Act 11223.
So there are a lot of issues that we are facing right now, especially with the COVID situation. Some have been actually hearing about these issues that even if you are not a COVID afflicted, sometimes the hospitals has declared that person as COVID patient because through the benefits of PhilHealth. What can you say about that, sir?
Well, again, these are all hearsays. They are all
It's
stories.
not true.
But for us, we need documents. We need complainants in order to give our partner hospitals and doctors due process. It's so unfair to just accuse them.
Yes.
If they do have evidences and documents, rest assured, PhilHealth will help them. And we will prosecute them because that is health insurance fraud.
Correct.
And we need to protect PhilHealth as a fund, the fund of PhilHealth, because we are all contributors, and the long-term benefit of being a PhilHealth member is that by the time we are senior citizens, we are lifetime members. And of course, when
automatic.
Then when we are senior citizens, that's the time that all the sickness are there coming out, and that's the importance of PhilHealth. We need to protect because PhilHealth is here. We need to ensure that its sustainability.
Yes. There's also issues. I just visited J.R. Borja City Hospital, and I have I've interviewed some nurses over there, and they were claiming that maliit daw ang contribution of PhilHealth, even though they have already, they're accepting COVID cases, and how come, the payment is still very low. So this claim is actually not verified, but we would like to clarify how is the hospital claiming and what kind of claim does for I know that there are categories for this, so you just don't know how much is the claim for this category. So give us a little more detail about that.
Well, first of all, there are certain COVID claims. The hospitals are limited in processing claims. We have 4 different case rates: mild pneumonia and moderate pneumonia. Then we have critical and severe. So it depends on the clinical management.
So if it's mild, there are also categories for that.
And for example, J.R. Borja, they are catering majority to mild pneumonia and moderate pneumonia.
Okay.
And also one factor is...
There are SARIs that also been classified for that.
As far as I know, Northern Mindanao Medical Center can cater to severe and critical cases. So nare-refer po siya sa higher hospital, which has the capability and complete equipment to manage such severe and critical. But I know for a fact that the J.R. Borja is seeking the assistance of the Department of Health, Region 10, to allow them to manage because of this pandemic. Many are getting
Right.
hospitalized. And
So I understand that they wrote a letter requesting that they can actually, cater to the severe cases of COVID now.
Yeah.
In terms of, their care, the healthcare system, they're trying to announce it to the public that, in response to the COVID situation now in the region.
Yes, yes. I got a letter yesterday about that coming from the Department of Health.
Okay.
And by next week, we'll be coordinating with JR Borja. And again, the bottom line is PhilHealth is here. We are your partners in health. And rest assured, we will ensure all the needed support by the private and government hospitals in northern Mindanao will be taken care of.
And the DOH, of course, will definitely visit JR Borja to assess and to make, probably an observation and assessment when it comes to our needs, especially the isolation facilities with all this respirators, ventilators. Are they available?
Yes.
Are they able to cater to that in terms of this critical care? So most likely, before they will be approved, they have to be approved by the Department of Health. Correct?
Yes, definitely, because the case, for example, if there's a level 1 hospital, under our policy, they cannot treat the severe or critical just to claim the high amount.
Right.
Well, the right perspective is that we cannot abuse the fund of PhilHealth. For example, the patient's family will request the doctor, can this moderate pneumonia amounting to 133,000? Can you do it to severe critical?
I don't think
that
so.
That would be a violation.
No, it's a violation because they have to be approved by the Department of Health before accepting those. So they have to make sure if they...
And I believe, ma'am, that our partner doctors and hospitals will not risk losing their license doing that. That's why we're giving them the benefit of that, of all these unfair allegations of abusing. But rest assured, if all our listeners or viewers do they know some of these shenanigans, please feel free to report it to me directly or to PhilHealth so that we can act on it and validate it.
Yes, that's right. And the big commodity there is actually to investigate and to know the details of these allegations. So with that in mind, we have a lot of benefits that have given to the people now, especially under crisis. And is PhilHealth okay with in terms of your funds? Are you able to stand alone and actually give still the benefit until at this time?
Yeah, we'd like to assure the public that PhilHealth funds are intact. In fact, it is sustainable because, we do get subsidy from the government. We have share from the sin taxes. And of course, there are mandatory contributions like us who are working. And what's important is that our members should know that they are entitled to these benefits. And it's our role in PhilHealth to provide them this financial risk protection so that they will have peace of mind in case their family members get hospitalized. They know their benefits. That's why I'm very thankful for this opportunity to inform your viewers about the various PhilHealth benefits.
Right. So enough with the COVID because we've been discussing all this COVID crisis, and I know that at least our televiewers and our the people out there are well informed now that whatever it is they're going through right now, PhilHealth is always there to help them out in terms of their situations right now. Now, one of the things that I'm very happy about is that the extension of the dialysis sessions. One of these beneficiaries is my tita. Actually, my tita almost died because she was actually positive COVID, positive with COVID, and I was really finding a hard time. And that NMC at that time was in code red, and I have to shed all of my tears to the mayor to actually plead just to let her get in, to be taken care of for the COVID and plus dialysis. So when she came out, I was very happy that it was announced by Senator Riza Hontiveros that we have additional 90-day sessions for our dialysis patients, which is a big help to our patients right now who's suffering especially for CKD, which is the chronic kidney disease. Some stages are really worst. And at least, we're given this, an extension for them.
Yes, I'd like to inform the public by virtue of circular number 2021-0009, the 90 sessions entitled for all hemodialysis patients, they have now additional 54 sessions more, so there's 144 sessions now.
144?
Yeah, so
Isn't it lately it was 90? And now it's,
it was,
oh wow,
before it was 45 days, but
okay,
due to the clamor of the dialysis community, it was increased to 90 sessions.
Okay.
Now that it's time of pandemic, in 2020, it was increased to 144.
Wow.
And now 2021, again, there was a clamor because of it's still pandemic, in order to cover the whole year. Kasi yung 144 sessions, kung 3 times a week ka, it will cover now the whole year. And per session, PhilHealth covers 2,600 pesos.
Right.
So times 144, that's around 374,400 pesos per dialysis patient, which PhilHealth is now helping or subsidizing for their hemodialysis treatments nationwide.
Sir, are you well aware that the JR board or the city hospital has also applied for their hemodialysis center? In fact, they were announcing that they were supposed to open it by October or November. Are you well aware that this is ongoing? And hopefully they will be opened on October, because there would be a lot of people that will benefit on this.
Yes, yes. Like any facility, they have to undergo the process. We have to ensure that the quality and the needed equipments are there in order to
facilitate,
ensure that the members will get the right benefits. And that's good news. In fact, in my first few weeks in Region 10, I immediately coordinated with the president of the Kidney Dialysis and Post-Transplant Organization, Ms. Shirley Manlangit, wherein I reached out to them and informed them that PhilHealth is doing its best for them to know about their benefits and to help them in case they have pending claims. We now have an open line of communication. And for me, that's one step, which is to empower, especially our hemodialysis patients, because they really need the help and support of PhilHealth in their medication.
So, sir, let me ask you, how much is the benefit for a hemodialysis patient to avail in every session?
It's 2,600 pesos is the coverage of PhilHealth. And then said amount, 350 is the professional fee, and the rest is for the facility. And the good news is that with additional sessions, it's really a big sigh of relief coming from all the dialysis patients.
So, sir, let me just ask you, what if under the 144 dialysis sessions has not been taken or has not been used or utilized? What will happen to those remaining?
Well, it's not cumulative. We cannot cover it in 2021.
Okay.
But
they have to consume it within the period of 2021?
Well, it means they have 144 dialysis sessions allotted for them.
I see.
In case that they don't utilize it, then that will be it. 2022 will be another story, but rest assured, PhilHealth is doing its best if they can still continue giving these 144 sessions. So for the record, the 144 dialysis sessions is for calendar year 2021.
I see. Okay. So at least there is a clarification on that, because there would be a lot of questions concerning. So how is the patient, if the person is not actually registered on the database for this hemodialysis benefit, how can they avail on this?
Well, of course, the general rule is they should be recorded in the PhilHealth dialysis database, because we need all this data. We are trying to study this data of CKD5 patients.
Right.
So we have oriented all our partner dialysis centers and hospitals to ensure that before they can join the program, the patient is enrolled in the PhilHealth dialysis database.
Okay. So in order for that, if the person has already been paid all of these benefits and was not able to get the one, supposedly that they were allowed to get the 144 sessions. Now, and then all of a sudden, they were paying this privately, and are they covered? Can they still claim although so that they have paid for the hemodialysis for their own private sessions.
Yeah, if they were not able to avail it and they are really entitled to it, we need to review, and they just have to prepare the documentary requirements and submit it to PhilHealth. And also, just like to clarify for the record, all claims are evaluated by PhilHealth. So the general rule, you have to follow our policy. In case it is denied, you can still have it file a motion for reconsideration. It will be reviewed by the Committee of Claims Review Committee. And in case you get a denial, there's still hope because you can appeal it to the President, and the claim will go up to the Protest and Appeal Review Department in the head office. So I'd just like to emphasize that we do review. I know it's a case-to-case basis, and it depends on the reason why you were not able to file it on the prescribed deadline and other reasons why you were not able to file it accordingly.
Right. So during this MECQs, we know that there were some restrictions that has to be followed under the IATF guidelines. And were these guidelines affected the how do you call this, the management, and were there affected through our, because you know there are a lot of people needed help from PhilHealth, and I know that there were skeletal workforce and there are work from homes, and how were we facilitating on this to respond the needs of the people?
Yeah, well, one good thing about PhilHealth Region 10, we have a COVID-19 task force, which meets regularly. We have to review the business processes of PhilHealth to ensure that our employees are safe, and also in how they should transact with their clients. For example, in our local health insurance office or frontline offices, we do strategize. We try to implement various strategies to give them. One pilot test was the virtual public assistance counter, wherein if they will go to our office, they need to talk to an agent. We have the laptop or a computer wherein they can talk virtually. So we are doing our best to utilize the latest in technology. They can contact us via email or chat with us through our official Facebook account, which is www.facebook.com/PhilHealth. And rest assured, we'll do out-of-the-box strategies just to ensure that the services needed by our members can be attended to accordingly.
Sir, there are a lot of members of PhilHealth also that are not computer savvy. They don't have any computers at home. They actually don't have cell phones, and you know. And how are we facilitating them in case if they really needed this to file a claim or something, and they're actually from far-flung places? How do we help them out? Yeah, well,
that's a reality. That's why if they need to really visit our office and transact with us face-to-face, of course, with strict observation to the health safety protocols, what we devise in the offices is that the documents that they bring will be put in a box, which we could sanitize it first. And then my marching order is to process all the claims within the day or the application.
With no delays.
Yeah, no delays, because we comply with the ease of doing business by the ARTA. So, and of course, we like to provide, we like to delight our customers. So that is one of my focus in Region 10, to further improve our frontline services and to be responsive to the needs of our members here in Northern Mindanao.
Right. So let's point out some of the issues that we have to, acknowledge. What do we encounter in terms of our claims? We have to tell and acknowledge those issues. That what are these issues that we actually encounter for this pandemic, and what are these issues that has affected our processing and of course our service to the people.
Yeah, one of the issues we are encountering is that the hospitals, we are doing our best to communicate, to improve our communication with our partner hospitals, and to guide the PhilHealth claims processors on our latest PhilHealth policies, and to guide them to attach the necessary documents so that once it's filed to PhilHealth, it will be categorized as a good claim. And for the record, the good claims being processed by PhilHealth, though we are given 60 days to process the claim by law, the average turnaround time in Region 10 right now is around 31 days.
I'm very much very thankful and grateful for Senator Bongo when he came. Actually, he have placed about a lot of malasakit centers all over the Philippines. In fact, I think there are already about 68, if I'm not mistaken, malasakit centers all over the Philippines, which is a big help to those that are not really unable to really claim.
Yes.
Kasi when you're sick, it's such a big problem when it comes to the payments, and even to purchase their medicines, and it's very hard if the government will not assist them on this, because it's going to be probably a big a big, how do you call this, a big failure on the government's part if we are not able to reach out to our less fortunate Filipino brothers and sisters who wanted to claim on this.
Yes.
So how are the malasakit centers a big help to our healthcare system?
Well, basically, it really complements the PhilHealth program, because all Filipinos are now entitled with the various PhilHealth benefits.
Right.
They just need to be registered and ensure continuous payment. And in case, because we pay the hospital's case rates.
Right.
So there are certain, most probably in certain disease, or they need to have some out of pocket. And malasakit will really complement this, because there's PCSO and other agencies that could help our kababayan. So,
and I was very pleased because when it launched here in northern Mindanao, in NMC and also JR Borja, the good senator has actually promised 10 million a month for this, fix every month, that this will be utilized for all those that cannot pay for their hospital bills.
Yes, yes. And ang magandang malaman ng mga kababayan natin, the government is doing its best to help and cope up with this pandemic. And malasakit is one of them. And aside from the PhilHealth, which is the flagship program of their president, the Universal Healthcare Law, in case there's out-of-pocket expenses, or there are certain not covered by PhilHealth, like the food of the companion of the patient, it can be channeled through the malasakit because of the various partners, agencies who are included in the malasakit program.
Right. So there are a lot of changes that has been felt by all our Filipino constituents in the Philippines, and there are a lot of changes in the healthcare system that they have really felt that the government cares for them, and this is one way of proving to them that this malasakit centers is one of the biggest factor, I think, the game changer of everything, because it was very hard for them to claim, or even to find something that they could pay off their hospital bills. Now we're on the zero bill through this malasakit center. So we thank the government for this, and there's a lot of changes. Two things that the government has proven, because there are two main factors, I think, in the Philippines that has to be addressed. One is education, and we have given them free education through our universities. And number two is the healthcare system that has, kasi pinaka-importante, health is wealth, they say.
Tama po. Tama po. Kaya nga po, I'm very thankful, because with you as partners in informing the public, kailangan malaman nyo po na meron tayong benefits sa PhilHealth, and maraming program ang government, pero to combat the inaccurate info or fake news or issues, for me, we have to address it directly. We have to address the issues and explain it to the public.
True, true. Okay, let's move on to one of the probably another issue that we're encountering right now, and this is the vaccine injury compensation package. Now, there are claims that when they had the vaccination, they died, and all these claims. Now, it was such a laughing trip for me, because wow, of all of those that have probably vaccinated in the Philippines are about 3 million a day or 5 million a day. You're the only one who died. So there would be a lot of answers to this one, maybe because there was a comorbidity that you were experiencing, or probably a transplant, or a surgery that has been done. Certain factors to be considered, and you did not actually been honest about it. So one of those that we investigated was there was a senior that actually died after the when he got vaccinated, but he didn't even say that he was undergoing, a heart transplant. So there are many factors that has to be considered. Now, if this will happen, what are the benefits of a vaccine injury?
Well, that's a good question. It's a law wherein this is in support of National Vaccination Program. PhilHealth is the fund administrator. That in
Right.
case there are fellow kababayans who will die due to serious adverse effect following immunization, we have a case rate package ready for the members or their family members in case na they will lose their life or they will be permanently disabled. We have
Right.
100,000 pesos case rate package. Again, this is will be until the national immunization program is finished, or we have a 5-year estimate.
Okay, but they can only claim this if they're under our database and has been enrolled for PhilHealth and been
Yes,
paying the contributions as well.
Well, it's very important they are registered in PhilHealth's database, and the key here is that it needs to be established that it is due to a serious adverse effect
Okay.
directly because of the vaccination. So may mga procedures yan, and it has to undergo a review medical test, like what you have said, medical evaluation, in order to ensure that it is because of serious adverse effect.
So is that the eligibility requirement?
Yes, one of the eligibility requirements.
Okay.
Yeah, and of course, as you have said in your example, they have to investigate. Paano kung hindi nagsabi pala na may ganitong kondisyones? We
Right.
have to check. And ang magandang
And if
balita dyan, we
they
have
did
this-
not, they will not
yeah.
be able to get the benefit.
They can be disqualified, but one good thing is that we have this standby just in case kababayan gets disabled or loses one's life. We have a
If somebody
COVID
died,
vaccination.
especially if the parents or the senior citizen had died, who is able to claim for this?
Of course, their next of kin, their legal relatives, so they can file it. And rest assured, PhilHealth will help them.
And then when is the period of the filing? Until when?
Well, until the national vaccination program is completed or there's given at least 5 years is the target. Yeah, 5 years is
see.
the target.
Okay, that's good. So let's talk about the innovations now, and we're very pleased to really talk about this because at this point at the ECQ we are experiencing so much devastations and destruction, especially with all of our people in the region that has been suffering through the ECQ status and the quarantine status that we have in the region has been affected so many people. Now. With this in Region 10, especially the frontliners, how we're protecting the frontliners and to protect our clients and employees for that.
Well, aside from reminding our staff to observe the health safety protocols, we try to rearrange our office layout wherein proper distancing is observed, especially in transacting clients. We utilized UV lights to sanitize documents.
Right.
And
I mean, we could also have that close contact because, COVID-19, especially with Delta now, that's very scary.
Yeah.
And the transmission could multiply in just in a span of
Yeah.
seconds. And, there are a lot of issues that I hear that the Delta could be spread through airborne. So
Yes.
that's one of the things that we have to be aware of.
Yeah, that's why in our offices, I'm trying to utilize virtual desks so that our members can still transact with us and utilize other platforms like social media, text, or any means like email.
And then the platforms of the media, of course, you also have to connect with the media because the media
Yes.
is one of the main tools
Yes.
or factors that probably could give you the best information to the public.
Yes,
Because we're
that's why-
always there every day.
Yeah, that's why
We're very present, and our presence is always felt in the people
Yes.
because they listen to the media. So that's one way of cascading our information so that they
Yeah.
will also be well informed.
Yes, I really value the help and support of the media. In fact, my hardworking information officer, Ms. Lynn Ibanez, every time she informs me that we have a schedule. I always say yes. We do accommodate
Yes.
all opportunities to talk to the public. And aside from that, in the office, I always schedule dialogues, not only with the patients groups. We also talk to the hospital owners, and
Yes.
soon we'll be talking to other organizations.
Right. So I think it's very important to will display PhilHealth with a good relationship
Yes.
in terms of our, with our LGUs and
Yes.
when in terms of our private sectors. And because we need to have a relationship with them so
Yes.
that there would be no miscommunication, especially with our information officer of PhilHealth
Yes.
has to know and be friendly with the media, because it's very, very important, because if you're not friendly enough, and then you will be crucified all the time.
Yeah, we know the big
you
help
know,
of
you know,
media.
media is very brutal.
Yes.
We're very brutal in terms to extracting truth and information. So if you are informative enough and you give this good public relations to the media can actually give you the pathway to information.
Yes, yes. That's why we really value our partners, our local media
Right.
partners.
Is there a new way with this MDR how to get into your offices? Because we need to also
Yes.
follow this one.
Yes.
So what are the new MDRs that has to be followed?
Well, one of the innovations implemented by PhilHealth is the member portal. You can visit our website, www.philhealth.gov.ph, and register in the member portal. And if you're registered with the member portal, you can view your record, and you can also print your membership data record. And for self-employed individuals, if they have updated their membership data record, then they can pay via online through our partner MYEG, via GCash, auto debit, or through credit card. So we're doing our best to utilize and to innovate so that we could be really responsive to the needs of our members.
Yes. And then we're just very fortunate that most of the vice president that's been placed in Region 10 are very well informed, and they actually engage with the media, which is very, very important. And I don't like that, because it's very important for you to engage, to really inform, cascade all the information. And you were very active now. You have a lot of guestings, and which is good.
Yeah,
Because
thank you.
during this pandemic times, if you are misinformed, it will be causing a lot of miscommunications and problems.
Yes.
But if the people are being well informed by this, that they can go and settle their claims, and they can actually have people to listen to them if they have problems with it. Well, that's one good thing.
Yes, that's why I really try my best to be available for media interviews, because we need to empower our members. And the only way to correct the misimpression or the wrong impression about the program is to inform them on the accurate information and the benefits. And of course, time of pandemic, all Filipinos are really on their toes, very worried because of this Delta variant. We are doing our best to empower our members, and I'm really thankful to you, ma'am, and to your program for this opportunity to inform the public.
Yes, there are also issues that we also have to address when it comes to the online fixers. And what are these issues that we encounter, that has to be addressed, and that the people are very worried about this, because, wow, we thought the fixers are only found in LTO, but there are online fixers too. So what are we doing about this?
Well, I was able to talk to some and call their attention. All the while they thought that they're doing this for convenience. But I informed them through chat. I informed them that the PhilHealth IDs and the membership data record can be secured for free in our offices. And in terms of convenience, we have these various platforms like the member portal, which I just mentioned a while ago, can be utilized by our members. So, and aside from that, I'm informing the public not to patronize these online IDs, fixers, because that is a violation of your data privacy. And aside from that, who knows, with the information that you are sharing to somebody whom you don't know, baka magulat po kayo, may utang na pala kayo sa credit card or what.
Right.
And your information can be used for other purposes.
It has to be protected, and you have to be careful about this because there's a lot of fraud that's
Yes.
happening when it comes to online banking transactions. So you need to be well aware of this, and that some people are trying to just fool you, and then there are gullible people that just
Yes.
just trust some people, and then all of a sudden
Yes.
they're not well aware that they've been already robbed
Yes.
by their identities.
Yes, all this, I know these fixers are trying to earn income because times are hard right now because of pandemic, but what we're informing them is that you should not do this. You should not abuse the program.
Yes.
And aside from that, what they're doing, maybe they're not aware, is a violation of the Ease of Doing Business or the Anti-Red Tape Act.
Right.
So they can be really arrested or penalized.
So, how do you handle the problems with this when it comes if there are complaints and if there are complaints and how do you handle this
Yeah.
through what process?
Well, it's one of the reasons why I'm very visible in local media. And in fact, I would like to inform the public about their benefits and their rights. And I also created a personal email wherein our members can send their request for assistance or complaints, or it's a sort of whistleblower email. It's actionagadprox@gmail.com. And rest assured, we'll assist and act on your concerns with PhilHealth.
Right. So we would like to say hello to Marlene Acosta from Bukidnon, Sahara Gay of Hingoog, Dinah Gabor, CDO, and Sherry CDO. Thank you very much for all of you out there who's been watching us. And sir, with our last minute efforts to actually give information to the people, now we've got about 10 minutes, so give this opportunity to remind our televiewers and of course our beneficiaries and claimants. And what are your message to them?
Well, my message is that andito po ang programang ng PhilHealth. We're doing our best to reach out all our members. Napakalaga po ng aming role ngayong panahon ng pandemya. Siguraduhin po natin na sa ilalim ng universal healthcare, tayo po ay rehistrado. Hindi po natin alam kailan tayo maaaring magkasakit o maaksidente. Na ang magandang balita po dyan, meron po tayong iba't ibang benepisyo. At sa pamamagitan ng pagbibigay ng tamang impormasyon, ako po'y naniniwala na ito po ay magiging gabay nyo po sa inyong pagdidesisyon para po tamang aksyon ng ating magawa. Para ating problema sa ating mga mahal na gastusin ay maramdaman nyo po. Yan po ang aming nais gawin ngayon dito sa Region 10, PhilHealth Region 10, na madaman nyo po ang PhilHealth ngayong oras na inyong pangangailangan. Maraming salamat po at magandang umaga sa inyong lahat.
Sir, do we have any hotlines that they can actually call?
Yes, we have hotlines, and aside from the email that I gave, it's actionagadprox@gmail.com. We have a text and a hotline, which will be announcing it in a while. I'm just going to get it from Miss Lynn.
Okay, Ms. Lynn, what are the hotlines so they can actually call right away right now? That is very important, that in case if they have questions right now, you can actually, link with us, and then we will link you to PhilHealth if that is also the case that you're trying to reach us. You can also reach through these numbers if in case you wanted to, that we will be announcing right now.
Yes.
So the numbers to actually call is 859-0225. This is what is this number? Philcom, PLDT. Philcom, the Philcom doesn't exist anymore. So that is actually the PLDT line that you can actually call. That is the number. Do we have a cell phone number for the hotlines? They don't have these numbers anymore.
We have a text line.
You do have a text line. Okay.
And we also have an official email, is actioncenter@philhealth.gov.ph. We also have a nationwide call center. It's 02-8441-7442, the Action Center. And we also have an official Facebook account. It's www.facebook.com/PhilHealth.
Okay, so that is a good thing that we really do have, the connection to the people when they, in terms that they just wanted to call and ask for information. So, ladies and gentlemen, on behalf of Jade TV, I would like to thank all of our televiewers. There are 80 Barangays here in Cagayan de Oro, thank you very much for watching. All the 24 municipalities of Misamis Oriental and 2 component cities, that is El Salvador City and Ingoog City, and of course, the city of Golden Friendship, where we belong, that is Cagayan de Oro City. Till next Saturday again, between 9 to 10 in the morning, this has been your host, Cheryl Macaulay Cariago, for the Cheryl Macaulay Cariago Show. Now remember, do not ask what the government can do for you, but always ask what you can do to the government. And let's help fight corruption. Ladies and gentlemen, have a wonderful morning ahead of you.